And good morning to everyone. Thank you very much for having me here. I will be talking about, as was shared, the rural perspective when it comes to health equity. Next slide, please. And for those of you that missed our CEO's presentation earlier, I am with the National Rural Health Association, and our mission is to provide leadership on rural health issues. Next slide. And we accomplish this through advocacy, communications, education, and research as part of our overall charge for assisting with these leadership issues. Next slide. And who are we really? So we serve as the voice for rural healthcare. We are a nonpartisan, nonprofit membership organization, and we have over 21,000 members throughout the country. We serve as a source of information for policymakers and NRHA members as well, and we are a trusted resource for rural stakeholders. Next slide. This is a brief snapshot of what our membership looks like throughout the country. This includes rural providers, so critical access hospitals, rural health clinics, community health centers, rural researchers, nurses, some dentists, oral health care providers. We've got 43 state rural health associations around the country and other interested rural health stakeholders spread throughout here as well. Next slide. So our overall policy charge as an organization, based on the membership that we represent, we are looking to sound the alarm and serve as a loud voice for addressing rural declining life expectancy and inequality. We're working to reduce rural healthcare workforce shortages and looking at investing in a strong rural health safety net. Next slide. I'm going to touch upon some of the rural health challenges. I know you've heard about some of these throughout the various presentations already this morning, and you also are probably seeing them firsthand in the work that they do, but just to kind of paint the picture of some of the inequities currently happening in rural America to kind of set the stage for this discussion. Next slide. So as most of you know, rural America is plagued in a way by workforce shortages, vulnerable populations, as well as chronic poverty. Next slide. We see this in terms of the shortage areas for the workforce. So we know that roughly 6,000 areas in the United States are primary healthcare shortage areas. So there's a true lack of basic primary care in rural communities throughout. About 4,300 areas are dental health shortage areas. Many of you also are aware of this based on the work that you do, and 3,500 also are short of mental health shortage areas. So just basic access to care is sparse in many of these rural communities throughout the United States. Next slide. We also see a prevalence of Medicare patients within rural communities that have 6 or more chronic conditions as well. So kind of confounding the access to care issue, we see a lot of personal physical health issues as well for these communities. Next slide. And we hear this a lot, rural is often viewed and defined based on what we know as older, sicker, poor. So you see many of the statistics here. Average median age of adults living in rural areas, it's greater than urban, as you can see here. 18.4% of rural residents are 65 and over, and they also have higher rates of several health risk factors listed here. So obesity, diabetes, smoking. Next slide. We also know that the cancer rates are also higher or death rates are higher in rural areas as well, based on other confounding factors and access to care issues. While they have a lower incidence of cancer than urban areas, rural areas have higher death rates. And you can see this between rural and how they're increasing over time as well. And we know that the pandemic also delayed a lot of care for many rural residents as well, given the conditions surrounding that. Next slide. So we know mortality rates, just a large rural divide in American deaths. So the death rate gap between urban and rural is getting wider. I mean, we're also seeing that in real time given the pandemic and the impact of that. So the 5 leading causes of death, heart disease, cancer, unintentional injuries, so forth, they're all higher among rural Americans as noted here. It is also tied to income and geography. Minorities, especially Native Americans, die consistently prematurely nationwide, but no more pronounced than in rural areas. And we do see startling increases in mortality of white rural women, looking at causes from risky lifestyle, environmental cancers, as well as suicides. Next slide. And again, the poverty. We know that nationally rural households have lower median household incomes. So you see the figures here, and 14.7% of rural population is below the federal poverty line compared to 11.3% of the urban population. Next slide. Rural housing, we see a striking difference between 1980 and affordability problems in 2018 and how that impacts rural communities as well. So we know that there is a big disparity happening in rural housing for residents here in this parts of the country. Next slide. Opioid fatality rates, again, highest in states with large rural populations. CDC has just also announced that, there were over 100,000 deaths related to opioid addiction and overdoses during the pandemic, which is the highest, or peaking at the highest throughout this pandemic right now. And so again, something else that is a critical issue for rural communities, and again, just further confounded by other factors contributing to these issues. Next slide. So pre-COVID, the rural provider environment, here's what we were looking at: around 1,400 total federally qualified community health centers, 4,500 rural health clinics, 1,300 critical access hospitals, 500 rural prospective payment hospitals, and only 9% of physicians practicing in rural America. And then 77% of the over 2,000 rural counties, again, being primary care health professional shortage areas. And then more than 50% of rural patients having to drive 60 miles or more to receive specialty care. This was sort of the state of the union for rural communities prior to the pandemic hitting. Next slide. And as well, but before COVID, we were also seeing an increase in rural hospital closures. So you can see from 2010 up to 2019 how the increases began. We saw 20 closures in 2020. We've also had some closures as well in 2021. So these are serving as, critical life points for rural communities. Once a rural hospital closes in a rural community, they are seen as a main economic driver oftentimes in these communities. And so there's a trickle effect of other things that either close down, shut down, the access points that continue to start to fail as a result of a rural hospital closing, making it even harder to get basic access to care for persons living in a community once this hospital is closed. Next slide. So, we've heard a lot. You've seen in the news, you've seen data points around, what the reach has been in particular for rural America. And this is a recent graphic depiction here of the infection rates. We know that it's higher in rural America. We also know that there's still a lot more unvaccinated in rural communities compared to urban counterparts. And we also know that there's a rise happening again in the pandemic as we speak. So ebbs and flows, we're kind of ebbing back up here. But again, this is just kind of further exacerbated the vulnerability of many rural communities. And we're seeing what a lack of access to care and resources leads to, especially now that, we're in a critical point for trying to curb a major pandemic here. Next slide. And, some of the things that have made headlines during this time in terms of health inequities for rural communities, just in the beginning, obviously trying to figure out who has ICU beds, who has capacity to treat patients with COVID in rural communities. At the start, there was a lot of urban focused concentration on it because of where the pandemic was presenting itself. And so there were rural communities sharing ICU beds. There were sharing workforce staff with urban centers to try to help curb things. And then as they were going back to their communities, kind of seeing that this was picking up in the rural communities they served, where they were already short of staff and beds. And so, then it came to, with the availability of the vaccine, was there a possibility to be able to store the vaccine at the temperatures that were needed? Was there capacity to distribute them? There was, some headlines making for the case that, there wasn't an even distribution of vaccines in rural communities that perhaps were intended for Black and Hispanic residents that were going to other residents, white residents out of town, as you see from one of the headlines here. There was a study conducted as well through the Journal of Racial or posted in the Journal of Racial and Ethnic Health Disparities about demographic differences in COVID-19 deaths between Black and white populations linked to structural processes implemented, which has been associated with structural racism, studied in 35 states. And so we've seen the impact of economic status, the housing, education level, incarcerations, types of occupations affecting level of exposure and pre-existing conditions, as well as population density, and just how all of these factors kind of created a perfect storm for the incredible impact that the pandemic has had on the truly, truly vulnerable populations within all of these subsets of communities. Next slide. So just in summary, again, the picture that we have is, the populations in rural communities being older, less healthy, less affluent, and having limited access to multiple types of care. And you kind of see the spread here when it comes to the population over 65, veterans, premature deaths, dental provider access, mental provider health access. And just so, again, it's rating low in all different areas, which, is what we know, what's taken a while to really bring to light, but that the pandemic just really sped up for us. And in some ways kind of has created this real opportunity to not ignore the numbers, to not ignore the picture that we have before us. Next slide. So with that, I just want to share some opportunities. I know we hear a lot of talk about, the things that are going wrong, but what can go right? How can we, be part of the action to address many of these issues? Next slide. So one of the things that we have been talking about a lot as an organization at the National Rural Health Association is, a framework for health equity. This moment in time has really caused a lot of inward reflection for an organization such as ours, but also outwardly, how we serve our membership, how, we are framing this issue for rural communities across the country. So we are looking at an 8-step strategy for prioritizing and making health equity more of a concept to attain than to just talk about, but to really get towards. And so they're all listed here, and I'll walk you through some of our thought processes for this, but I share all this in the hopes that perhaps this will be of benefit as you look at that for either your organization, the work that you do, the partnerships that you develop along the way, and as well as the research that you want to acquire to also help address some of these issues. Next slide. So again, the pandemic, but as well as all the statistics that I shared with you before, have really shown that health equity is having a moment. And, are we able to meet this moment in history? Are we able to address it? We have, again, with all these challenges, has come a great opportunity to start talking about health equity more than we have ever talked about before. And so for more than 27 years as an organization, we've had a national health equity conference. So bringing together community-based organizations, their policy stakeholders and the like, who are sharing what's really happening at the community level, getting their story heard, sharing current research, but also just having it labeled under the health equity conference is really a step in the right direction. This is something that gets the dialogue going. It's a chance to share information. It used to be called the Multiracial and Multicultural Health Conference back in the day. And as things have evolved, it was clear that this needed to be called the Health Equity Conference. And so that was done under the leadership of our Rural Health Equity Council. The second step that we've been looking at is strengthening the role of leadership. So through our leadership foundation within the National Rural Health Association, we are looking at empowering the next generation of rural health leaders. And not just empowering them, but teaching them how do we navigate policy at a state, local, national level, but also looking at leaders, representing diverse communities and that are also diverse themselves, because we want to better be able to reach those that we need to serve. But as we look ahead, making sure that we are able to have leaders that understand how to make their voice loud, how to carry messages to members of Congress, to local leaders, to state legislators and the like, but also how to use research to make sure that that is a compelling case for creating a sound policy to make a change in communities. We're also looking at engaging communities through humble inquiry. We do this by collaborating with the broad spectrum of healthcare interests. So, we are the broad spectrum. We represent all rural healthcare interests. We're divided by constituency groups. So we have a hospital systems constituency group, a state resources constituency group, rural health clinic, research, federally qualified health centers. And so we bring all of those folks together through our board of trustees so that every voice is ensured a seat at the table when it comes to making policy for our organization as a whole, and so that it is truly representative of all the rural health issues of concern across the country. Next slide. So we're also looking at supporting data infrastructure and analysis. Again, research is critical. We don't know what we don't know. And there are so many gaps. A lot of folks have, commented on the stark differences of how the pandemic in particular has impacted marginalized minority populations. But we've seen those gaps. There hasn't been a lot of research done on so many different factors related to these groups, particularly in rural areas. So there's still a lot that needs to be researched and designed to better inform policy going forward. We do have a quarterly publication, the Journal of Rural Health. We do try to focus on a lot of health equity related issues within that, and it is distributed across the world as well. We're also part of the All of Us research program collaboration that is sponsored by the National Institutes of Health, trying to ensure that their research is inclusive of all diverse communities to better, again, showcase what is truly happening in communities across the country through research. And we're looking at tackling the tough issues. So, our organization, I'm very proud to say, issued a statement condemning racism last year, which is a big deal. Our organization had never, made a statement as monumental as that through the course of its history, but saw, again, the moment, the right thing to do. But again, addressing this is all part of healthcare, and healthcare access is also addressing some of the tougher issues that impact healthcare. So social issues all, are connected within this as well. Next slide. So we're looking at making health equity part of standard operating procedures. So again, as I mentioned earlier, we look at advancing policy and systems of care through our Health Equity Council. So every policy that is issued or supported by the National Rural Health Association and shared with members of Congress always has a health equity lens on it and perspective. So we look to develop these recommendations. We have our own Rural Health Congress within NRHA, and they establish the policies for the organization based on membership input. And again, we've had successes which have established national policy on health disparities, rural veterans access, border health issues along the US-Mexico border, community health workers, and access to rural maternity care as well. And we're also incorporating this within our own staffing practices, making sure that who we have on staff is also reflective of who we are serving as an organization. And we're also looking at creating programming and policy sustainability. We've got health equity policy that can be found through this link here within our website. And this will be a constant evolving programming to make sure that, again, how can we best help the communities we serve if we don't have an understanding program design that is suited to address some of these health equity issues within rural communities. Next slide. So we're also looking at developing a robust pipeline. So you've seen the slides that I shared, a lot of, what isn't working in rural America, the things that are negatively impacting them. And there's a stereotype associated with rural America. What you hear oftentimes, what makes the headlines, again, white, older, poorer, sicker, uneducated. All of that has painted this picture of rural America as just being behind always. So we are working on a Faces of Rural campaign to really change the national dialogue of what rural America is and what can happen in innovation when it comes to living and working in rural America. So we're looking to launch this in the next year to, again, accurately highlight the diversity of rural Americans through representation and best practices. So we will have a campaign that showcases Native American, Indigenous populations, the work being done in various communities. We've got a border health initiative, that showcases great work being done along the US-Mexico border in rural communities. We're also looking to develop further programming in the Delta region as well, and things that are happening with community health workers, the things that they are doing under difficult circumstances to help people with access to care. So there are so many things happening in rural America that are innovative that you don't often find in larger urban centric areas. And so we want to make sure that we help move the needle, because the further that we can showcase the great things that can be done in rural, we believe the further along we can get to achieving more health equitable care and access for these communities. Next slide. So one of the things that is helpful in addressing a lot of this is, again, we've got 43 state rural health associations across the country. I believe there are lifelines as an organization. They are boots on the ground folks. They are the ones that are really seeing what's happening on the front lines of rural healthcare. And they are the ones that we call upon when we need to round the troops, so to speak, to help get legislators to sign on a bill, to help address, what's happening. An example with the pandemic, our CEO and several other leadership on staff, have been talking to the media, trying in the beginning saying, hey, don't forget, this is impacting rural America. A lot of news was covering, what was happening in urban, but it's, this is happening in rural. It's a matter of time, and they don't have the resources or the staff to really address it. We need, the spotlight over here. So this was really key in reaching out to our states, making sure that local health departments were letting us know what was happening where they lived. How could we be a resource? How could we really sound the alarm for what was going on? So advocacy, again, being a voice for rural healthcare. These folks also meet annually in Washington, D.C. And try to help meet, they meet with their members of Congress and, again, share what's happening in the communities that these members serve and represent, as well as some of the research, the data points that they have to share. They also have an annual State Rural Health Association Leadership Conference, bringing their board members together as well as their executive directors, and just providing technical assistance. And we also do that through grants that we provide them annually as well. Next slide. Some other opportunities, a lot of the great work being done right now, but even before the pandemic, this model is over 20 some years old, of the community health workers, the lay health workers in rural communities. And we've been working with several around the country and having this rural specific training network to make sure that community health workers have access to the educational tools that they need to serve the communities that they're in. They've been very integral, obviously, through the pandemic. We started this training network back in 2012, focused on the rural communities of the US-Mexico border. So we know that they've served in key roles as translators, as transportation providers, as nutrition information providers, just basic health information and resources. We've conducted trainings in Appalachia in a partnership with Verizon, utilizing technology to try to improve health outcomes, particularly with diabetes, and using iPads to see how we could change the outcomes of A1C levels for patients in that area. We've done many oral health related focused trainings through a partnership with the CareQuest Foundation, and this has been very helpful since we learned, many providers in medical school only received a few hours of oral health care training in their studies, and so we've actually had oral health care providers and, as part of these or medical physicians as well in some of these other trainings alongside the community health workers to understand more about oral health care. And I think Dr. Brand is on here, but my favorite quote of hers is to get primary care doctors to look at ear, nose, throat, and teeth, and adding that in there as well, looking at the bigger picture. We've had COVID-19 focused trainings offered nationally as well. One thing that was critical was making sure that, again, they were the ones going door to door oftentimes in communities, do you know that this is out there? How do you keep your family safe? So a lot of these trainings have been done online for their safety, but have also been able to, continue on going forward and hopefully in person. They've also been integral in getting people registered for vaccines or testing and helping with contact tracing. And today we've had over 2,000 trained in various areas, again, of oral health, COVID. They focused on the Zika virus, opioid addiction, nutrition, cancer prevention and intervention as well. Next slide. I mentioned earlier our Health Equity Council, they again have been a key part of our organization and offering their lens and perspective on everything that we do as an organization, highlighting the needs and concerns of rural underserved populations. And it includes, multiracial, multicultural, LGBTQIA, veteran and homeless populations. They do plan the Health Equity Conference that I mentioned earlier and provide representation within our Rural Health Congress and our Board of Trustees. And again, they've also been integral to the statement we issued on racism and an issue that happened a few years ago in Arizona. We were looking at we had a conference hosting in Arizona. And at the time there was discussion about legislation on looking at background checks and ID checks. And so there was concern within the membership. And so we wanted to make sure that it didn't hinder access to care. So we did issue a statement at that time as well. So again, they've really guided us as an organization when it comes to health equity issues, and again, are really helping push the needle forward to again capture this moment in time to help see what other solutions that we can bring to the table. Next slide. I also want to share, I briefly highlighted it earlier, but we do have a national rural oral health initiative, and this is in partnership with the CareQuest Foundation, and we do look to provide leadership on rural oral health care to elevate it again as part of primary care. And so again, it focuses on 4 aims of policy, communications, education, and research. We've developed a special oral health interest group to provide policy recommendations and analysis. So sort of a rapid response team that has helped us looking at regulatory issues. They've also developed research policy briefs to make sure that we have official policy within some of these oral health issues as an organization. And they've used these to share with members of Congress. Through communications, we disseminate rural oral health information and best practices through our weekly e-newsletter and our Rural Horizons quarterly publication. And education, we've integrated rural oral health tracks within most of our 8 annual conferences. So we have a rural oral health track within our Policy Institute that we host at the onset of the year within our annual Rural Health Conference. Our Health Equity Conference has an oral health track, as well as our Rural Health Clinic and Critical Access Hospital conferences. So again, really making sure that these are priorities within our educational programming. And again, established an oral health training within our community health worker training network. And I'm proud to say We were the first organization to help adapt the Smiles for Life curriculum to be applicable for rural communities and rural community health training workers to be trained using this curriculum. And so I know it is now being shared throughout, which is fantastic. We've been able to provide these trainings in English and Spanish along the US-Mexico border, as well as other parts of the United States. And then we've also had our state rural health associations providing them with assistance to also focus this particular area of priority within their educational programming as well, which has also been very critical in help moving the needle on this issue within different states around the country. And then the fourth aim here within research, as we look to advance rural oral health care related research, we've had submissions published within our Journal of Rural Health. We had our rural oral health interest group talk about the gaps in research related to rural oral health care, and there are many, as I'm sure folks can attest to here. And so we were able to have some of those published within the journal. And again, that is critical for driving policy. We know that to create sound policy, you need critical research and data to back that up. And again, we want to really emphasize the need for more research in this particular area. So this has been an important pillar of this particular initiative. We are currently working on the fifth proposal, as we've been invited to submit for a fifth year of the National Rural Oral Health Initiative with the CareQuest Institute. So are working on that as we speak. But during this time from years 1 to up to now, we definitely have been able to not only educate ourselves as an organization on, what we can do to address rural oral health care as part of primary care, but what else can, we do within our membership. We've had more leaders also come through our Rural Health Fellows leadership program that have an oral health care background, which has been critical. We know there's a shortage of oral health care within rural communities. And so a lot of it was trying to figure out the who's who in this world for rural communities. So, we have been growing that aspect of the organization as well. Next slide. Oh, one more back. Yes, thank you. So we've got, I think this is a lot of information to share. I know many our folks are familiar with the challenges. We talked about some of the solutions in terms of strategy for addressing health equity as an organization, but also in partnering. And one of the things, again, the strongest tactics we have at the ready are the advocacy components of our organization and materials that are readily available within our website. So our advocacy team focuses heavily on the legislative, executive, and rural health coalition sectors of partnerships to make sure that we are able to really address critical issues happening in rural communities. So we help with letters to congressional leaders. We've got lots of templates on our website to help with that, letters of support. We've got legislative resources, so looking at analysis of regulatory issues impacting rural communities, helping folks that maybe don't have experience writing comment letters on regulatory issues, but that's where we can assist. Also partner with congressional caucuses and coalitions on Capitol Hill to make sure that they are apprised of what's happening in real time in rural communities. With the executive branch, letters to the administration and regulation comments, we're very proud during the pandemic, our organization was able to really help champion provider relief funds for rural communities. A lot of the focus at the start had been on urban centers. And so we really advocated strongly to make sure that rural providers were included, that there was a set aside specific, that language specifically, highlighted this assistance for rural communities. Otherwise, it would have been an uphill battle trying to get assistance. So this is where the collective voice within the association with the experts such as yourselves really came into play to make sure that it wasn't forgotten or overseen at a critical time. Again, I mentioned the regulatory comments, providing letters to Health and Human Services when needs arise to address certain issues when we know regulatory barriers are impacting rural communities. And then we do have partnerships with many health coalitions to make sure that rural is at the table and is part of the national dialogue when it comes to different topics related to rural health or healthcare in general. We've got a lot of different coalition members, and again, providing letters of support there. You know, I will say, again, not added on here, but another approach and materials here that are accessible. The state rural health associations, many of them also have their own resources around the country as well that they work with. And the whole idea here is, you know, you've got these tools at the ready. We've got a legislative tracker for perhaps areas of legislation that you might be passionate about or that are integral to the work that you're doing. So there's a tracker on our website as well that you can help, look through as well to address some of the issues that you're working on. So just a lot of different resources. We do have folks within our membership that oftentimes are also asked to help testify before Congress, because that really is a compelling way as well to help shed the spotlight and the work that you're doing, what's really happening. Telling your story is just so critical when it comes to getting the ear of policymakers, to making sure that they understand what's happening, that there's not a blind eye to what you're seeing firsthand in the work that you do. And next slide. All right. That's a lot of information, I know, to share, but I'm also happy to answer any questions. I'll turn it over to you.